Hi, my name is Renee Ali, student number ALL80097. This is part B to my role play 1. It's my discussion and reflection for Sam. So question 1 is to explain your rationale for selecting a particular technique. By using cognitive restructuring questions with Sam, I'm opening up a window of opportunity to look at his negative automatic thought in a different way. We are also challenging the negative automatic thought and restructuring the way Sam thinks about a situation which causes him a great deal of anxiety. I was trying to show Sam that he has trained himself to think a certain way and that his negative automatic thought is his core belief because of one isolated incident. However, if we just shift that a little, it allows for flexibility in the way that we think and feel, leading to significant changes in our behaviour. By using cognitive restructuring questions, I am demonstrating to Sam how he can practice a technique with himself to develop mental muscles that he had not been formally using. By Sam restating his original beliefs in a less distorted, more accurate way, he can start changing the stress-related thought, which will in turn reduce his anxiety. Question 2. Evaluate the effectiveness in implementing the technique employed and identify areas for improvement. I believe my performance needs work. I felt a little nervous during my session. I think I could use with working on my confidence levels. I felt as though my nervousness could be making my client nervous also. I believe my technique has worked with Sam. He was able to challenge his negative automatic thoughts, which I believe reduced his anxiety by allowing flexibility in his thinking pattern. This will assist him in facing a similar situation for his upcoming presentation with a more realistic perspective. I believe if we continue to work with Sam on restructuring his current narrative over the next few weeks, this will lead to his intended goal, which is overcoming his anxiety and social phobia. My aim is to bring Sam to a point where he can develop the ability to catch himself in the act of dysfunctional thinking and to correct himself in real time so that he doesn't feel anxious or distressed. I believe that my cognitive restructuring technique could have used more measurements for accuracy and evidence-based questioning. Next time, I would like to ask Sam a few more questions that test the accuracy of his negative beliefs and thoughts. I did not feel role play was an appropriate option with Sam, as this is a more second to third session technique. Once Sam trusts me and becomes more comfortable with me, then we can move on to a more hands-on technique. Also, tapping into these emotions with Sam in real time could be extremely distressing for Sam, and we don't want that for him. Number 3, reflect upon the application and limitations of applying CBT to address your client's needs, issues, and goals. I would eventually like Sam to be exposed to a behavioural experiment. For example, giving a mini presentation of about 3 or more people to test his hypotheses of what will happen to him when placed in a particular situation. I would also like for Sam to give his work colleagues a survey so that he can assess how his presentation went and if there is any room for improvement. When the client is ready for this, it can be just as beneficial in shifting out the negative automatic thought process and also learning how to handle criticism in a more productive manner. I feel a limitation to my chosen technique is the fact that it is not an easy skill to learn and it takes much practice to master. Just because I have one session with Sam reconstructing his thoughts does not necessarily mean that he will believe his new narrative. This happens over time and with perseverance. Thank you for listening.